According to the Institute of Medicine, 44% of schools across the United States have no physical education classes since the passage of the No Child Left Behind Act in 2001, and now Common Core. Schools are teaching to test results, which has resulted in PE classes being cut, and kids' physical health not having a priority placed on them. Only around half of America's youth meets the U.S. Health and Human Service Department's physical activity guidelines for at least 60 minutes of vigorous to moderate intensity exercise each day. In just 2 generations, the rate of active play, physical education, and overall physical activity has dropped by 32% in the U.S. Between ages 9 and 15, American kids' activity levels drop by 50 to 75%. For many kids, an inactive lifestyle has become the norm. 5.3 million deaths will be attributed to physical inactivity, while smoking, long considered a leading killer, is responsible for 5 million deaths a year. The WHO ranks inactivity as the number 4 result of death and a leading cause of the top 5. Only around half of America's youth meets the U.S. Health and Human Service Department's physical activity guidelines for at least 60 minutes of vigorous to moderate intensity exercise each day. According to the most recent Kaiser Family Fund study, 8 to 18-year-old adolescents spend an average of 7.5 hours a day on screen time. Imaging tests of obese children, some as young as 8 years old, showed signs of significant heart disease and heart muscle abnormalities, according to research presented at the American Heart Association Scientific Sessions 2015. Parents should be highly motivated to help their children maintain a healthy weight, said Dr. Yon, Ph.D., lead study author and a researcher at Geisinger Health System in Danville, Pennsylvania. Ultimately, we hope that the effects we see in the hearts of these children are reversible. However, it is possible that there could be permanent damage. This should be further motivation for parents to help children lead a healthy lifestyle. An estimated 1 in 3 children ages 2 to 19 are either overweight or clinically obese, putting them at a greater risk for diabetes, high cholesterol, and high blood pressure. Lack of regular physical activity and high amounts of screen time in front of televisions and computers has also been cited as an issue for children's health. This implies that obese children, even younger than 8 years old, likely have signs of heart disease too, Yon said. At Play to Health, we plan to take a stand against this growing epidemic. For physical activity to contribute to reversing the trend in childhood obesity, a multifaceted solution will be required that involves schools, the home, the neighborhood, and local planning and provision. Our goal is to instill lifelong health and fitness habits in students through nutritional education, gym activities, yoga, martial arts, and even fun and purposeful recess. Our solution provides online training videos, articles, and nutrition plans to assist in our children's health and well-being. We get kids moving and engaged in active play in seconds. Subscribe now to engage your child in healthy, fun, physically active games and fitness.